Well, good evening, everyone, and welcome to tonight's Meet Melbourne Live 2020 webinar on veterinary medicine. This is our 10th webinar in the series so far, and tonight, obviously, as the name suggests, we're going to be focusing on studying veterinary medicine, veterinary science at the University of Melbourne. My name is John T. Hall. I'm the recruitment coordinator in the Faculty of Veterinary and Agricultural Sciences, so I'm person to go to with their future student related questions. Yeah, tonight we're joined by two other panelists, the DVM Program Director, Dr. Natalie Kortman, and one of our recent DVM alumni, Dr. Katie Whittle, who is the class of 2019. Before I get us into the webinar, I just wanted to acknowledge in the spirit of reconciliation that the University of Melbourne and ourselves acknowledge the traditional custodians of country throughout Australia, particularly the lands on which our campuses are located, and the connections to land, sea and community. And we just would like to pay our respect to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples. With all that in mind, we'd like to get straight into it, and I'll hand over first to Natalie to tell you all about what it takes to study vet medicine at the University of Melbourne, and then we'll hear from Katie, and we have got plenty of time for questions as well later. So over to you, Natalie.
Great, thanks very much. So firstly, welcome. Oops, now I'm having trouble with mine. Yep, welcome everybody. A little bit of background, as Jonty said, I'm director of the DVM. I teach clinical pathology through all the years of our veterinary program, hence the microscope and various passings in the background. And so it's my great pleasure to just explain to you about what studying veterinary medicine means and some career paths that come out of that. So firstly, why would you choose veterinary medicine? Personally, I'm very happy that this was my choice in career. It's a very rewarding career. It's very fulfilling. It also branches a lot. And so you have tremendous opportunities after graduation. Why choose to study it at university? It's absolutely fascinating, learning medicine and surgery, understanding animal function, and being taught by some very clever people across a broad range of things. When you've graduated, you join a global community, and particularly, within Australia, we feel like we're a family of veterinarians. It doesn't take many degrees of separation to know a lot of people, but you make a lot of contacts through the course with people throughout the world, particularly with our international student cohort, but also as you're attending conferences and your ongoing learning after graduation as well. So it's definitely a good choice of career. In terms of how many places we take a year, so currently we accept around 135 students each year, and 50 of those places are currently reserved for international students. And we love the diversity of that cohort. We like to have students from all over the world. They bring a lot of richness and experience to the cohort, and as I said, also help make us contacts all around the world for the future. It's a 4-year program, postgraduate, so you enter via the science pathway, and we'll talk about that in a moment. There is an accelerated pathway that I'll also talk about, but essentially it's a graduate level program of encompassing 4 years of study. So if you're really keen on veterinary medicine, and I guess most people that choose that career choose it because you love animals, so that's a pretty common response. But why choose to study it at Melbourne? Because there are other faculties where you can study medicine in Australia and certainly internationally. The faculty at Melbourne for the delivery of the veterinary program, it's ranked 16th in the world for veterinary science, so that's a great honour that we're ranked so highly amongst world leaders in providing a DVM degree. It's postgraduate professional entry, so our students are very mature coming into the program. They've got the basics of science in their background, in their training, and then they come into a program that's very globally focused and incorporates a lot of evidence-based medicine and surgery, leading techniques in teaching and learning. And so very progressive course that we are constantly improving and changing, which is exhausting for us, but great for our students as we're constantly trying to strive and improve and also adjust our curriculum according to where the veterinary industry is changing over time. We're the oldest veterinary school in Australia, and so we have a lot of experience built up over the years and handed on by generations of teachers in teaching veterinary students, and gives us a lot of reputation internationally as well, because we've been doing this for quite some time. And I guess my focus, I'm a teaching specialist at the university, and this is quite unique. A lot of universities don't have teaching specialist roles in their DVM, and Melbourne is very unique for that. We have a really great pool of very passionate and experienced teaching staff whose focus is training students to graduate from the DVM. We also have a very talented group of researchers that engage in the teaching, but I think that teaching specialist stream is one of our unique things. We have a support network where we exchange teaching ideas and innovations, and that's pretty exciting for me as a teacher. The other great thing that we offer at Melbourne is we have a tracks program. So first and second year, it looks the same for all students, but in third year we have a tracks program that we introduce that allows you to undertake some further experiences in the areas that you think are going to be of most interest to you in your career. And those categories are production animal, so farm animal type areas, particularly cattle and sheep, but other animals as well. Small animals, so your urban practice type animals, and that also includes some of the pocket pets, as we call them, the little wee furries and birds and all sorts of other small things. Government, industry and conservation health, which we call GITCH because that's a big mouthful to say, but it's quite it really helps prepare students for a career in quite diverse related industries after graduation. So whether that's in conservation medicine or whether those are some of the government roles that we have veterinarians in or in industry. And then we have an equine track. So those who are very focused on horse medicine and surgery can choose to have those extra experiences in third year. But ultimately our program is designed to train everybody to be a general practitioner in all species, so to be a mixed practitioner. And so we have a core program that carries right through the DVM, and then your ability to not really specialise but tailor your program is through these tracks program, and also in our fourth year, which I'll talk about shortly. We have a lot of hands-on prac classes. We also have student clubs and social activities, and I'm sure Katie will talk a little to that about the things that she really enjoyed going through as a student. And certainly for any veterinarian, you form lifelong friendships with your peers that you study with. And it is very different in the DVM because you have a genuine cohort experience. You share the same subjects as you go through. And so you really bond with your cohort, whereas often when you're choosing an undergraduate degree, science or biomed or whatever that might be, you'll find you're with constantly different groups of people and they're much larger cohorts. So certainly in the veterinary cohort, you form really strong friendships that will last you your life and they become your second family. We also have out at our Werribee campus particular accommodation for students that want to stay on site. So you can literally roll out of bed or even turn up to a lecture in your pajamas if you want to, and you're right there, which is fantastic. Important for thinking about not just for our international students that are coming to study, but particularly for our graduates that want to go and work internationally. This degree program is recognised and accredited with not just the Australian accrediting body, which is called the AVBC, Australasian Veterinary Boards Council, but also accredited with the American Veterinary Medicine Association, the AVMA, and the Royal College of Veterinary Surgeons. So that's the UK accrediting body. And so that entitles you, visa permitting, to work in many different countries and regions throughout the globe. And personally, I took up this experience. I finished university, I worked for a couple of years in Australia, and then I went and worked in the UK over 2 different periods of my career, and could just basically pay my registration and step right into working in the UK, which was a fantastic privilege. Work in other countries and territories, I guess, you know, there's always some local registration rules and things, but certainly throughout Australia, New Zealand, Singapore, Hong Kong, USA, Canada and the UK, this degree is recognised and would allow you to work, as I said, visas permitting. So how do we structure this 4-year program? Well, first year, we're really introducing students to the basics of animal design, if you like, how an animal is composed and how the various systems of the animal integrate with each other. You'll move through the bioscience subjects, and you also start to learn the fundamentals of microbiology, parasitology, so learning about bacteria and viruses and parasites that infect animals. You also start to, that's more second year, but certainly the parasitology and things is more second year as well. But anatomy is another big thing that you'll start to learn in first year. And the other thing we introduce in first year is basic animal handling. So we train our students to be safe in handling various species in first year, and then you'll go out on placements on farms to hone that experience that you've had in handling animals under our tuition. In year 2, we continue those bioscience subjects, and as I said, we dig deeper into the microbiology side of things, some of the infectious agents, etc. Learn epidemiology, veterinary public health, and a few other topics as well. And you continue those non-clinical placements or farm or industry-based placements to start to see what's the breadth of where veterinarians are involved, but also to see to get experience with understanding how the production systems work, because we recognise that many of our students come from rural backgrounds and they've probably never set foot in a farm, and these are tremendous opportunities to go and work with farmers and really understand how that works. Now, I can remember as a student before I started, it was a Bachelor of Veterinary Science that I did way back, feeling very nervous about this idea, going out to farm placements and thinking I'm not going to know anyone, I'm not going to know what I'm doing. The farmers were great, and we help you organise all those placements. So I don't want that to be a source of anxiety like it was for me as a Year 12 student when I was thinking about what to do at university. In year 3, we start to switch. So we've built up a foundation in first and second year of the scientific information that you need to know. And then in third year, we flip that to start to think and train you to think like a clinician. So how does a clinician approach a case, use this background information that we've introduced in first and second year, and how do I start to apply that to scenarios? You'll get more hands-on training so that you start to learn some of the more key veterinary skills, you know, how to put in catheters, how to do injections, all those sorts of things. And we start to prepare you for surgery. And ultimately, towards the end of your third year, you get to participate in surgery, neutering operations, etc., having had all of that training through third year, under supervision, of course. And you'll be doing those tracks. So along with your core information that you're learning, you'll also be covering off those tracks in the areas that you're particularly interested in. Fourth year is pretty hectic. It's a clinical year, so we have you in our veterinary hospital going through rotations. You're seeing lots of different animals as they're presenting to our hospital, and you're helping to care for those animals. You're participating in consultations, all of those things. You're also doing placements at clinics around Australia and internationally as well. We have quite a number of clinics that we have approval for going to internationally, and you get to choose those extramural placements, as we call them, or EMS. You get to choose where you want to go and do those placements within some guidelines that we have. So this is really where you hone your particular interest, or if you change your mind and you've done, say, the equine track in third year, but as you've done it, you've realised, oh, maybe I'm not so interested in horses now. Maybe I'd actually like to switch to, say, production, broader sort of mixed base production systems. That's when you can start to get those experiences in fourth year. So, but as I said, everybody comes out a general practitioner ready to work in mixed practice. So we have an online management system that manages all our placements, both our farm or preclinical placements and our clinical placements, and it works really well. And at any time point, we can see where all of our students are throughout the world. So this was a snapshot from quite some time ago, from 2017, but you can see that there are little pin marks in lots of different countries, but most of them are still in Australia at that time. So entry pathways, we can see that we enter through either as a school leaver, you'll do a science degree either at the University of Melbourne or somewhere equivalent, and then you will enter the DVM1 as a DVM1 student and you'll do 4 years of training. If you choose to do science at the University of Melbourne and you do very well in your science degree, we do have an accelerated program so that you can, by choosing the animal health and disease major, you can basically start to take DVM subjects in the 3rd year of your bioscience degree. And so that way you are sitting alongside of students that have come in from a graduated science degree. You're actually there as your 1st year, effectively a DVM1, but technically according to the university system, you're still called a Bachelor of Science student. So you're essentially doing all the same training. And so then you join as a DVM2 student in the 2nd year of the program, having accelerated through. So it saves you a year of training to do this accelerated pathway, and it also potentially, if you're a full fee paying student, saves you a year of fees as well. So we do have some guaranteed entry pathways, and so you apply for that through VTAC, and these are guaranteed CSPs or Commonwealth supported places for high achieving school leavers, so that you achieve a really high mark in your ATAR and then you're guaranteed a place. You then, as long as you maintain a good average that's at least 70% across your science subjects in both 1st and 2nd year, to keep that Commonwealth supported place for the DVM. You have to have started your Bachelor of Science degree within 12 months of finishing year 12. And we do have a new online situational judgment test that's also being used to screen students for the program, to make sure that the students that we're choosing are going to be able to cope well with the program and have the right attributes to be a great veterinarian. But it also means that we can actually diversify, and potentially down the track, as we've introduced this, it might change some of the entry scores, and in fact slightly lower them as we open up the cohort to try and select students with different criteria, rather than just selecting purely on mark and the letter of application outlining your experience with animals that we were using. So your guaranteed entry pathway, you apply in the 2nd year of your Bachelor of Science at Melbourne and work through the system with that. So this is where you can have a full fee. So this is a guaranteed Australian full fee paying place for high achieving school leavers, or a guaranteed overseas full fee paying place. And again, the proviso there is that you, whilst you're doing the science, need to keep this average of at least 70% across your science subjects to keep that guaranteed entry into the DVM secured. But certainly if you're a really high achieving school leaver and you get a really high ATAR, then you can secure these places, and then as long as you work hard in science, then you'll be into the DVM through your science degree at Melbourne. We have some beautiful facilities for teaching our students that we've had developed very recently. We opened these only a year ago, or a little bit more now actually, but essentially we've had a major redevelopment at our Parkville campus, so that we have a beautiful teaching building which we call WEBS, but it's a beautiful learning and teaching building that has spaces for learning anatomy, learning microbiology, having collaborative learning, etc. And yeah, some really great breakout spaces and things for students too. And then we've also had a major development of our Werribee campus. So we have beautiful laboratories and teaching spaces at Werribee, collaborative learning spaces, clinical skills centre, a fantastic teaching unit for learning surgery, a beautiful theatre set up purely for teaching with state-of-the-art equipment for monitoring our patients, etc. And at Werribee, we also have our animal yards. We have our animals that you'll use to learn handling, etc. on, as well as having our hospital that has the incoming patients. And so down the bottom right of screen there, we have an image of our emergency room, which is part of the hospital, where animals come in. It's open 24/7, and animals come in just like they would at an ER department at a hospital, and they get triaged and treated there. So really great facilities for learning. And you've got some extra images there. Out at Werribee in our UVet hospital, we have our small animal hospital, which basically, if you think of everything that all the services that you might tap into at a human hospital, we have specialists that support those services in a veterinary context. So we have a general practice, so where you would go and see your GP doctor. We have GP vets for seeing animals. We have a medicine and surgery specialist and a service for those. We have cardiology specialists come, we have neurology specialists consult through the hospital. We have an equine unit as well, so we have equine medicine and surgery as part of our hospital. We have dermatology service, we have some ophthalmology service. So some of these we don't have resident academics that are there all the time, but we get specialists in to provide these services and to give our students training. We have our own laboratory for running tests on animals to check whether they're healthy or not, and that's what I run, so I'm a clinical pathologist. We have our imaging, so we have CT, MRI, all the fancy bells and whistles, and ultrasound and scoping and all of those things that they do in people, we can do in animals. And as I mentioned before, we've got our emergency medicine critical care, we have pain management experts, anaesthesia specialists, and we also run a shelter medicine rotation in conjunction with the Lost Dogs Home, so that students get a chance to participate again in neutering surgeries, but also to learn a bit more about shelter medicine. So as I said, we had a substantial upgrade of those facilities, and they are fantastic. So once you've got your DVM, where do you go and work? Well, I mentioned before about the international options to you, but essentially what sort of careers do people go into? It's extremely diverse. Most people start the DVM because they're thinking about becoming a vet in a practice, and that's certainly where the majority of our graduates go, particularly straight after graduation. But we certainly see graduates branching out over time into government, into research. You might join academia like I did after quite some time in practice, or pretty soon after you've graduated, so into education. We have veterinarians involved in animal welfare agencies, agricultural industries, pharmaceutical companies, and if you want to become a specialist, then we do specialist training at our hospital as well. So we train our graduates, and they'll go through a residency program and become trained and sitting special exams to become specialists in a field that they're interested in. So lots of different things that you can get involved in as a vet, and hopefully that gives you a little bit of a taster of what studying might be like. But in fact, the best person to tell you about what studying might be like and doing the DVM is Katie. So I'm going to hand over to Katie, who's one of our super lovely graduates, and she was a pleasure to teach. So I'm looking forward to hearing what she has to say. Do you want the next slide, Katie?
Thank you, Natalie, and hi everyone. I hope you're having a good evening. So as both Jonty and Natalie have said, I graduated at the end of last year. I'm now working in a small clinic on the Mornington Peninsula. So I'll just quickly tell you a bit about myself, and then we're going to go to questions. So my route was a little bit unorthodox in that I had dreams of finishing school, getting accepted into the DVM, and then doing my 2 years of science and taking the fast track. But unfortunately that didn't happen. I did my 2 years of science and had terrible grades because I was young and immature and didn't study much. So when that all came crashing down, I decided to take a gap year. I did a little bit of work at a vet clinic. I did some volunteering overseas. And then once I was refreshed, I came back and did my final year of animal science and did a lot of the agricultural subjects. So next slide, please. Next slide, Natalie.
You don't want the aspirations? No.
Oh, I didn't say that one, sorry. So for me, I knew that I wanted to be a vet ever since I was tiny. People I think knew that I was going to be a vet before I did. For me, it was always about animal welfare, and later on, when I took my gap year, I got into wildlife work, and you can see a few of my foster babies in those photos. But everyone's different in the course. So we do have a lot of rural kids. We have people from overseas. We have some people who have never even had a pet before. They just really like the idea of working with animals. So it doesn't matter even if you aren't sure what you want to do right now, just keep an open mind. And if this is a career path you think you'd like to go down, then I highly recommend it. So yep, next one. Sorry, I think there's a bit of a delay on my slides, but we'll get there.
That's all right. Yep. Yeah, it should be showing you the DVM placement slide.
Natalie's gone. Yeah, we got that one. So Natalie's gone through a bit of the structure of the course, in that the first 2 years you're learning about all the different animal systems based on body areas, I guess, and then in third year they switch everything around because you've learnt so much that it's all a big confusing mind map. And then I think third year is just a whole roller coaster of light bulb moments. But in between that, the best part of the whole DVM experience is definitely placements that you get to choose and organise yourself. So I did a lot of them with my friends that you make in vet school, who definitely do become your friends for life. And yeah, you get to organise anything you would like within a certain category. So you have to do a little bit with farm animals, a little bit with small animals, and then there's an extra category, which was my favourite. So I did a fair bit with wildlife, including turtles that you can see there. And even for the farm animals, I managed to escape working at a cold, muddy dairy, and did things like working with sheep and milking goats for 2 weeks, and with donkeys and pigs. So it's all a lot of fun, and yeah, it's all, you're responsible for organising that. And then, so that's your first 2 years of doing more hands-on preclinical work. And then in your third and fourth year, especially fourth year, it's a lot of clinical rotations going between different practices, hospitals. You can work with specialists, just to dabble in a few different areas and see what you'd really like to work in the future. Thanks. Next one, please.
Yes, it's got the advice slide now, Katie.
Excellent. So overall, I'd say my biggest word of advice to anyone who's hoping to become a vet is to just fuel your passion and never ever give up. So I was crushed when I didn't get in after second year, but that didn't end up mattering at all. I got in after my 3 years. A lot of people have done further studies, such as honours, masters. We have a lot of PhD students in my level. We have some people who went off and were a music teacher for 6 years. We have a world-class cheerleader. We had a 60-year-old engineer. We had a female scientist of the year. We had absolutely everything, and it really didn't matter. So as long as you know that you want to be a vet, doesn't matter how old you are or what your experiences are or what you've done, just keep trying, and it really doesn't matter which track you enter in. And most of all, just look after yourself, and in your working up towards it, yes, there are a lot of, do the prerequisite subjects for sure, but apart from that, do what interests you, because that's what's going to give you the best chance of getting good grades. So I did a lot of not strange subjects. They were all animal related, but not ones that were specifically medical. And because that's what really interested me, that's what helps motivate you when you are going through uni and stressing about trying to get into vet school. So just make sure you're doing what you enjoy, and then you'll be able to get through it. Yeah, I think that's it. So I'll hand back to Natalie, I think, or Jonty.
I think to Jonty next, the Q&A.
Thank you so much to both Natalie and Katie for sharing those insights. Yeah, I'm sure we've got a number of questions tonight. I think some were sent through before, but some people have also been asking questions tonight. So one of the first ones that's come through here is how much experience with handling animals should you have before beginning the course? And perhaps Natalie, you'd like to
Yeah, I'd love to answer that. I think in terms of making you comfortable, the more you have, the better. In terms of requirements for the course, there's not an absolute requirement, but it really does help to have had some animal experience coming into the course. We do favour that in terms of looking at the application letters and applications that we get. Not so much because the experience handling animals is essential, but it shows a committed interest. So the more you have done with animals, the more that we know that this wasn't you choosing to say, I want to do the DVM on a whim, that you're really focused on the animal industries that veterinarians support, and so yeah, it's about commitment to the course and commitment to working with animals more so than it is about you having that handling experience. Now, we totally recognise that with many urban students, they are not going to have been to a farm, but if you've volunteered at animal shelters and you've had urban animal experience, that counts just as much as whether you've worked on a farm. So yeah, the more things that you can kind of do to show that you have a sustained passion for working with animals, that will help your application and also help you in the course, make you more confident as you start to do things with animals in the course.
Great, thanks, Natalie. Our next question here, which I will probably throw to both of you, since I believe you were a GITCH student, is that right, Katie? You were, yes. This one is, what are some of the careers that can result, or I guess are related specifically to the government, industry and conservation health track? Did you want to start, Natalie?
Sure. I mean, they're quite diverse, and the thing with that track is that it is very diverse. So some students have done, I know, have done that track because they were interested in working in regulatory bodies, or they were very interested in epidemiology, or they were interested in animal welfare and looking at working outside of a clinical situation. But a lot of them actually choose that track because it gives you a bit more wildlife experience, and so that conservation interest might mean that you're interested in working in a clinic in the future that does quite a bit of wildlife work, or you're interested in becoming a zoo veterinarian, or somebody who works in conservation health. So it's super diverse, and as I said, it doesn't commit you to any of those jobs, but it just gives you a taster for a whole heap of experiences that are beyond what a normal clinic experience would give you. Katie, do you have anything to add about, you know, what you expected from GITCH and then how you use that now?
I think for me it was because normal vet school doesn't branch into that as much, so I really wanted to see what it was like, because my dream was always working with wildlife and exotic animals, so that allowed me to not only learn more about that side of the industry, but also meet a lot of those people, which is very important. So I used it as a networking experience, which meant that I got to spend 7 weeks in my final year working at zoos. I ended up doing my research project with the zoo, so I spent extra time there as well. And yeah, for other people, it may have been for working for the government or for animal welfare agencies. So it's not only being able to branch out and learn more, but also about who you meet and the areas that you get to see.
Excellent point, Katie.
Great. We have another one here, which I might actually start off just answering a bit myself. So we've been asked, what's the difference in the pathway between the Bachelor of Science versus the Bachelor of Agriculture? This is quite a common question because out of our three, we have 3 degrees at Melbourne that can lead into the DVM directly, and those are Science, Agriculture and Biomedicine. Science is definitely the most common, and as Natalie's already said, it's the one that allows students to do the accelerated pathway and save themselves that year. But it's by no means the only option, and agriculture is a reasonably popular choice as well. The main differences are, it really comes down to that, whether it's the 6-year or 7-year program. So agriculture students are graduate entry to DVM. With that said, there is credit available of up to 2 subjects, I believe, Natalie, if that's still the case, of from the production animal major in agriculture. if students have completed the right subject.
Sorry, Jonty. Yeah, that's likely to change because we're restructuring some subjects at the moment. So I wouldn't want to promise that to them. We'll have to look at that once the subjects are restructured. Yeah.
Yeah. Well, in any case, the production animal major in agriculture will allow students to at least gain some more familiarity with animal science. So they're both good options, but students who are planning from day one to be a vet are probably mostly going to be aiming for science, but you're by no means disadvantaged in applying as an agricultural student.
And if I can jump in there, Jonty, I actually think doing agriculture as a first degree is a fantastic idea for the DVM. And the downside is you can't do the accelerated pathway. That, to my mind, is really the only downside. I think the experience that you get from really exploring the agriculture side of things really helps frame you for a mixed animal practice experience really well. So, and I think a lot of that learning that you do, even if it's not credited in terms of a subject in DVM1, that foundational learning will mean that you'll find those subjects in DVM1 a lot easier. Yeah.
Great, thanks.
And I'll just add, because I did do science, there is a bit of crossover, so I still was able to do a lot of the agricultural subjects with the ag students, so you're not bound either way.
Yeah. As Katie said, do what you're really passionate about. If you're really passionate about and think that agriculture might actually be a career option for you, not just the DVM, then that's what you should do as your undergraduate degree. So, yeah.
Cool. Our next question here is about overseas study opportunities. I suppose, I'll probably ask you to go into a bit more about where students have gone, Natalie, but I guess the main thing to note first up is that it's mainly placements, isn't it, rather than...
Yes, so there's no opportunity to go and do a subject overseas within our framework, but there certainly are opportunities to do your preclinical EMS or your clinical EMS overseas if the placement is approved, and so then you're covered by insurance, etc. And there are some scholarships that can help with some of the costs associated with some of those placements. And also in your final year for your clinical EMS, there's certainly opportunity for you to go and do some of those placements overseas in veterinary practices overseas, either through universities or non-universities. So not really an opportunity to go study subjects, but an opportunity to get experience in overseas as part of the program. Yep.
Did you want to add anything, Katie? Or
no, I think Natalie covered that. That's fine.
Our next question, getting down to brass tacks, how much do veterinarians get paid on average in Australia?
Yes, I don't know the current figure. I don't know if you have that to hand, Jonty, but the sad news is not that much. I think Katie will probably agree. Relative to some other professionals. So if you compare yourself to a medical doctor, then you're going to be a little bit disappointed. If you compare yourself to the average wage of an Australian, then you'll be okay. So anything from, I think that the starting salaries might have been, I can't remember if I can remember this number, close to 50 or 60,000.
I think it's currently 54,000.
There you go. Thank you, Katie. I thought you would be the one that would know that better than me. And then I think once you've been in practice for quite some time, I certainly know friends that, if you take on a practice and you run it as a business, there's an opportunity to make more money that way. Or if you take on a management of a practice, then you might earn, 100, 120,000. If you become a specialist, then you might earn anything from 100 to 200,000. But they're the exceptions that get up to the 200. I think if after you've trained a lot or you've got your own business, then probably closer to the 100K is probably realistic. But certainly as a new graduate, around that sort of mid-50s mark. So not a lot of money, but enough to live on. So yeah, don't do it for money. A lot of people think vets are really rich. They are so not rich. So yeah, it's a kind of a running joke in our industry that everyone thinks we're wealthy because it costs a lot to take your pet to the vet. So everyone assumes that means the vets are making a lot of money, but it costs a lot to provide those services in terms of equipment, labour, etc. So actually vets don't make that much money. We do it for love.
Thanks, guys. Another question here, which, yeah, a bit more of an admissions question. How many of the places each year are Commonwealth supported places? Did you want to answer that, Natalie, or I can?
If you've got the figures in front of you, Jonty, because unfortunately I don't have them in front of me. So we had 50 international places, and then well, have you got the number in front of you? I think it's
It basically, as I understand it, varies a little bit. There is a minimum of 50 per year.
Yeah, I thought it was
but
50.
Yeah, it could be a bit higher than that given the funding situation, but that does vary from one year to the next. So I guess for anyone who's watching who's a domestic student, the main thing to bear in mind is it will always be more competitive to get a Commonwealth supported place than a fee paying place, just because obviously the fees are substantially lower for Commonwealth supported. If anyone wants to know about the fees, I won't go into too much detail here because it does depend on your own situation. But if you go to the study website of the University of Melbourne and look up the DVM, you can find all of that information there. Yes, Commonwealth supported places are the more competitive option. All right, and we have another one here. Do you have to do BCE chemistry and physics in order to do well in the course? Probably the short answer to that is
Katie wants to answer that, Jonty. What do you think, Katie?
Cool. Short answer is you don't, because I didn't. I dodged them, and then when you get to your science degree, you can just do the catch-up courses. So it's fundamentals of chemistry or fundamentals of physics. I did one of them. I think I did chemistry as a summer course, so I smashed it down in 2 weeks. I'm not saying that's easy, but it's doable, and you can get away with not doing it in your final years at school.
Yeah. Yeah, I mean, there's no doubting that you need that fundamental knowledge. And so whether you do that in your university degree or whether you do it at school, there's no doubting that you need the fundamentals of chemistry and physics, but the route by which you get them is quite flexible.